Well, many of you have heard of scoliosis, especially from screenings done in your school nurse's office growing up. But how common is it? How is it treated? Dr. Scott Sorenson is a pediatric orthopedic surgeon at Penn State Children's Hospital, and he joins us now. First of all, tell us about pediatric spine care at the hospital.
Thank you. We have an excellent group of pediatric orthopedic surgeons at Hershey Penn State Children's Hospital that take care of kids with a variety of spinal disorders, such as little toddlers with what we call early onset scoliosis, stiff humpback deformities, athletic low back stress fractures from sports, and then most commonly scoliosis in adolescent teenagers.
What does scoliosis really mean? Is it a curvature?
Yeah, excellent. Scoliosis is a side bend curve of the spine of greater than 10 degrees.
Okay.
So many kids have a small asymmetry in their spine, but on an x-ray, once it's greater than 10 degrees, by definition, that is scoliosis.
How do most parents become aware that their child has scoliosis? Is it those school screenings?
Yeah, frequently it is. It can be the school screenings. Oftentimes it's from the pediatrician or the primary care doctor, and a lot of times it's just mom and dad are noticing some sort of asymmetry, such as one shoulder is a little higher, the waistline might be a little off on one side, the front chest wall might be a little more prominent on one side, the shoulder blades are more prominent. So a lot of times in the summertime, the parents are like, hey, I don't really pay attention to my kid's back that much, and then all of a sudden we were at the beach in the swimming pool or at the beach in the water, and I saw the swimming suit, and I could tell something was not normal.
Is it very common?
It's about 2 to 4%. So 2 to 4 out of 100 kids will have scoliosis.
Does it always have to be treated? Is it dangerous not to treat it?
It depends. The most important thing is to detect it early. So it can be dangerous if it's very severe, and unfortunately we do see it a lot of times where it's been neglected and they show up and it's a very large curve in the back, and that can be a problem. But most of the time it's not a big problem if it's detected early.
Okay, so let's talk about treatment. There's surgical, there's non-surgical. What are the options?
There are a variety of options, and that's a great question. Parents are always wanting to know that. So it all depends on how early you catch it. So if it's, when we're talking about the curve magnitude in the back, if it's less than 25 degrees, we usually just watch it. If it's 25 to 45 degrees, then a brace is a great option, and the brace can help kind of slow down the progression of the curve. Once it hits 50 degrees, then sometimes we have to start talking about surgery. But a brace is an excellent option for someone who's still growing and they're in the 25 to 45 degree curve range.
How long would you wear a brace?
Yeah, that's excellent. They usually wear it for a year to two sometimes. It's usually between 1 or 2 years.
It seems like catching it early is really a great option, especially for kids, because that's tough. It is tough for kids to wear a brace in front of their peers or something like that. So if you catch it when they're really little,
it's very important to catch it early. So the brace use, it's a challenge, and it takes everyone buying in on it. So the mom and dad have to support it, the school has to support it, the coaches have to support it. They have to wear the brace for about 13 to 18 hours a day. Typically, I tell patients that they don't have to wear it to school, but they wear it immediately when they get home from school and then through the night, depending on what kind of brace it is.
That can take a lot of relief off the children,
right,
I think.
Right.
Well, doctor, thanks for sharing this with us today. Hopefully it helps some parents out there in our audience.
I'm happy to be here. Thank you.